Cuomo. I will now turn it over to Governor Cuomo.
Good morning, guys. I'm joined by Melissa DeRosa, Howard Zucker, Robert Mahica, Beth Garvey, Kelly Cummings, Gareth Rhodes. Let me give you the latest and the greatest. Today is day 354. Positivity 3.58. Good news. Post-holiday surge reduction. Maybe just the post-holiday reduction continues. 7-day average positivity has declined for 40 straight days. It's 3.6 today is the 7-day average. It's the lowest 7-day average since November 28th. 109 New Yorkers still passed away with all that progress, and they're in our thoughts and prayers. Hospitalization is down 46, 6,574. The ICU is up 2. The intubation is down 24. By region, number 1, not winner, number 1 loser. Long Island 4.5, Mid Hudson 4.4, New York City 4.3, North Country 3.7, Western New York 3.1. Remember when they were on the top of the highest infection rate. Finger Lakes 2.2, Capital 2.0, Mohawk Valley 1.9, Central New York 1.6, Southern Tier 0.8. That's statewide 3.6. In New York City, Bronx 5.7, highest but down. But down. So that's good news. Queens 4.5, Staten Island 4.4, Brooklyn 4.3, Manhattan 2.5. Manhattan's still the lowest. Variants of interest. 82 UK variant cases, up 12 since Saturday. 11 of the new cases are in New York City. 1 is in Broome. Vaccinations. More than 3.3 million total doses. 2.2 first doses. 1 million second doses. 94% of the doses of weeks 1 to 9, that's what we're now administering, are in arms. Good news is President Biden announced another increases in doses for week 11. I spoke with the county executives yesterday and local health commissioners, mayors. I went through with them the number of distribution programs that are now running, which I did in my presentation on Monday. Federal government runs a number of direct allocation programs. Federal government gives to pharmacies. Federal government gives to federally qualified health centers, community health centers. Federal government runs FEMA sites in concert with the state. Federal government gives to the state. State gives to mass vaccination sites. State gives to pharmacies. State gives to FQHCs. State gives to the locals. Locals give to pharmacies. Locals give to FQHCs. Locals run mass vaccination sites. So you have a multiplicity of distribution outlets run by both the federal, state, and local governments. Well, there is no central point of clearing. Yes, because there is no central point of clearing. NGA letter to the federal government said, let's please coordinate what pharmacies you're doing, what FQHCs we're doing, so at least we know what pharmacies are getting what, and what FQHCs are getting what. But there is a multiplicity of distribution. That is now creating confusion. Now, this was a system set up originally by the Trump administration. And it does create confusion. At one point, the situation will reverse, I believe. because at one point we'll have a significant amount of doses. And when you have a significant amount of doses and they are available and you don't have an availability problem, you don't have a supply problem, then the multiplicity of distribution points will actually be a positive. But that's when you have enough supply. And enough supply, they're talking about the end of June now. Why so long? Because when the Biden administration came in, the cupboards were bare. They had to secure the doses from the pharmaceutical companies, which the Trump administration had not done. But March, April, May, it will continually get better as the supply increases. But right now it is, no doubt, confusing. I said to the county executives and mayors, it is essential that they are doing a fair distribution. Fair by geography and race. In other words, if you take a county, you can see where the distribution sites are, and you can see who is getting the vaccine. It is very important that the distribution be fair. This is a precious resource. Everybody wants it. There's not enough. The best you can do is make sure that you are fair. You're fair among 1A, 1B, 1C, 65 plus. You're fair geographically. That it's not just the urban areas that get a vaccine, or urban areas don't get more vaccine versus rural areas. When you look at the demographics, that the vaccination rate is fair. Now, we know we have a vaccine hesitancy problem, especially with the black community. We know in the hospitals when you offered it to everyone, repeatedly, easily, just come to floor 3 and get a vaccine, you had a lower vaccination rate among blacks. I know that. So let's make special efforts in that regard. And that has to be done. But the fairness of the distribution, I've asked all the locals to take a look at. Erie County, you have, and I'm going to announce in a minute, additional mass vaccination sites. You then have a county-run site. You then have pharmacies. Erie County, when you look at the totality of distribution, when you look at the vaccination rates, look at the fairness and correct for the fairness. If Cheektowaga is low, open up a site in Cheektowaga. If the east side of Buffalo is low, open up a site in the east side of Buffalo. New York City, we're going to have a big FEMA site in Queens, FEMA state site, 21,000 per week just for Queens residents. We announced we're going to have a Brooklyn site, 21,000 per week just for Brooklyn residents. All right. How about the Bronx? When you put that much vaccine into Queens and Brooklyn for those residents, the Bronx now has the highest positivity. How do you make sure the Bronx is equal? You look at the racial data, you are going to see a lower vaccination rate with blacks. Part of it is access, but we're working very hard on access. Part of it is hesitancy. I know, but then we have to work harder in those areas to get those numbers up. To date, we have set up 91 pop-up vaccination sites to help with the vaccine hesitancy with the black community. Churches, community centers, public housing complexes. Those sites have done about 43,000 first doses to date. We're opening 13 more pop-up sites this week: Onondaga, Rochester, Ithaca, Schenectady, Buffalo, Haverstraw, Port Chester, East Hampton, and one pop-up in each of the 5 boroughs. We're also announcing today, the way we announced Brooklyn and Queens as joint state, FEMA, federal sites, mass vaccination sites in what they call socially impacted, socially vulnerable communities. That's Queens and Brooklyn. 21,000 at each site for that county. We're opening another 4 in socially vulnerable communities. In Buffalo, at the Della Van Grider Community Center. In Rochester, former Kodak Hawkeye parking lot at Avenue E. In Albany, Washington Avenue Armory. In Yonkers, the New York National Guard Recruiting Center. Each site will do 1,000 per day. That's very large. That's 7,000 a week. They start on March 3rd. They get an allocation from the federal government. They're jointly run between the state and the federal government. We're going to use National Guard personnel to help us do that. But I want to thank President Biden for that and the Coronavirus Response Coordinator, Jeff Zients. This is a very big and aggressive effort to address vaccine hesitancy in the black community, and I thank them very much for that. Also, on vaccines, we have concluded vaccination of all nursing home residents and nursing home staff who would take the vaccine. There are some nursing home residents who refused. There are some staff who refused. But they have all been offered first and second doses, and the only people left in that category are residents who refused. We'll continue to or staff who refused. We'll continue to watch it, and if you have new residents who come in, people who change their mind, new staff, we'll be able to provide them doses. But of the people who are all there now, they have been all addressed. Okay. Amusement parks. Let's look forward a little bit to some warm weather and some amusement. Beginning March 26th, indoor family entertainment centers can reopen. Department of Health will list the guidelines: 25% capacity, face covering, social distance, temperature checks, frequent cleaning and disinfection. Riders' attractions that cannot be socially distanced or clean must remain closed. Outdoor amusement parks can reopen starting April 9. Outdoor amusement parks, April 9. 33% capacity. Face covering, social distancing, temperature checks, cleaning, disinfection. Tickets sold in advance, stagger entry, exit. Summer camps. As of now, overnight summer camps in New York can plan on reopening. That doesn't happen until June, and we hope the current trajectory stays until June. One eye on these variants of interest, but they can plan on reopening. They're going to have a testing protocol, but by the way, no parent is going to send their child to a summer camp unless there's a testing protocol anyway. Storm update. Some of the deliveries from the federal government of the allocations may be delayed this week because of storms across the country. They made that clear on the White House call this week. and we are experiencing that. Not storms in New York, but storms at the transportation hubs. We'll also have potential of storms in New York starting tomorrow, lasting into Friday. This is the set of storms moving across the country, and the state is acting appropriately, but these are serious storms, and people should take them seriously. Last point, I just want to comment on a story that was in the Post today. And look, I have been open and candid when I have disagreements with someone politically. I had ongoing disagreements with elected officials in the past, Mr. Trump among others, and I've been very honest about them. I've had my office, more than me, has had a long and hostile relationship with Assemblyman Ron Kim. It goes back to the issue on nail salons. We passed a bill that we worked very hard to protect nail salon workers who were often victimized by businesses. Wage theft was prevalent. We passed a bill. Assemblyman Kim supported the bill. He then flipped 180 degrees because the nail salon business owners found the bill onerous. There was a big New York Times story on it at the time that said basically, and I don't want to paraphrase a Time story, but it basically said he supported the bill, he signed the bill, he was at the bill signing. Then the business people in his community got upset, and then he changed his position, actually used his lobbying firm to lobby on behalf of the business owners, continued to use that lobbying firm and that political operative as his own, and then raised money from those business owners, and continues to. And I believe it was unethical, if not illegal, and I believe it's a continuing racket because he's still doing it. Citizens Union says in the New York Times piece that corrections are always needed when enacting policy, but it doesn't look right when this new bill is coming on the heels of strong financial support from the nail salon owners. The euphemism is pay to play. And I believe that, as I said, Mr. Kim acted unethically, if not illegally, on that matter. And my office is in that story. So it's been a long-running situation. But as far as his point that we didn't provide Department of Justice with information, that is 100% wrong. He knows it. We paused the state legislature's request for information, which I've now said 15 times, so we could comply with the Department of Justice information. And the Assembly and the Senate knew we paused the state legislative. And there was no obstruction of justice in not providing the state legislature with information. And they knew about it. So that is 100% wrong. As far as the suggestion that the immunity bill for hospitals and nursing homes was passed because of campaign contributions, which is the allegation against Mr. Kim, right? That bill was passed in the budget by the Assembly and the Senate. So if he wants to accuse his Assembly colleagues and Senate colleagues of the same conduct he's been accused of, pay to play, that's what he's doing. For the Post also with Mr. Kim, he has a meeting last week with other legislators and members of my staff. On the tape at the meeting, he says positive things. There's then a story that moves in the New York Post where he says the exact opposite and is very negative in quotes. I called him up, and I said, I don't understand. You were positive, said positive things in the meeting, and then the Post has you saying negative things. He told me the Post has misquoted me. And I called the Post reporter, and she refused to correct it. I said, really? Yes, she refuses to correct it. I said, well, my suggestion is you then do a statement where you put out your correct statement. Because if, the reporter doesn't want to include it, fine. Then do a statement that corrects it. Yes, I will do that, he says. And then he never did it. So much for Mr. Kim's credibility. And I said to him on the phone, there is still integrity and honor and decency in politics. But that's that for Mr. Kim. On the Post, look, the essence of this, the Post's continuing point on nursing homes, which is the Republicans' point on nursing homes, and it has been for the past year. Donald Trump started it. That is true. Fox News, New York Post, Tom Reed, Stefanik, this is the Republicans' point. They want to say the March 25th nursing home order was wrong. They want to say that the March 25th order brought COVID, is how COVID went into the nursing homes. Now, they coincidentally leave out that the March 25th order was done after guidance by Trump's CDC and CMS. How do you get to the fact that we were wrong following CDC and CMS without saying it was Trump and CDC and CMS? I understand this is politics and you don't need facts, but this is a kind of blatant deception. We followed the CDC and CMS. So if you want to say it was wrong, then you have to say Trump was wrong in the CDC and CMS. My health experts don't believe it was wrong. And we've gone through all the facts several times. If we did believe it was wrong, then we would say we believed it was wrong and we made a mistake following the CDC and CMS guidance. And then I would sue the federal government for malpractice on their CDC and CMS guidance. The same way I sued the federal government on SALT and sued the federal government on their immigration policy and sued the federal government for their global trusted traveler program. I would sue the CDC and CMS for malpractice, and we followed their advice, which was malpractice. That's what I would do if I believed the March 25th memo was wrong. But our health experts don't agree with that. And the facts don't support it. So I understand the political argument. But even the political argument has to have some credible logical basis. And leaving out the fact that we followed federal guidance is just wholly distortive. I understand it dissolves their theory, and I understand they don't want to give up a political theory. But at one point, basic fact has to have some place in the dialogue. All right, let's take questions, please.
As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the # key. Please stand by while we compile the Q&A roster.
Hello. Operator, any questions?
Your first question comes from the line of Gwen Hogan from WNYC.
You can call me Gwen. You can call me Gwen. You can call me Gwen. Just don't call me late for dinner. How are you doing?
My name's Gwen. Thank you, Governor. Thanks for taking my call. I appreciate it. I was just, I'm following up on what you said on Monday. You said that there was nothing to be investigated in how your administration responded to nursing homes and the handling of the pandemic overall. You said that revoking your emergency powers or the possibility of subpoenas in any kind of investigation, you described that as extortion. So I'm just hoping that you can clarify, do you think that any oversight of your administration's handling of the pandemic is like extortion, or are you open to potential oversight hearings in the coming months?
No. Let's take a step back. Oversight is fine. Oversight is the legislative role. Oversight is also the executive role. I said there was no reason to investigate whether or not I turned over information to the federal government or whether I did not produce for the state government, because I admit that we did not produce legislation for the state government. I said that we paused the legislative request, which was basically simultaneous with the federal request, and we told the houses that we paused their request. So do you have to investigate whether I paused the state legislative request? No, I admit it. We paused the state legislative request. We did that so we could focus on providing everything to the feds, and we have been providing information to the feds. Extortion is this. I'm going to use, and this is what was reported in the papers, okay? Let's use subpoenas and investigations to leverage the governor to give us things in the budget that we want. Let's use subpoenas and investigations to leverage the governor to give us money in the budget that we want. That is what people in the newspaper said is extortion. You can't say, I'm going to investigate you on one thing to get you to do something else that I want you to do. Okay? So, I'm a district attorney. I say to a bank, I may investigate you and I may subpoena you for bank fraud unless you give me a mortgage for a house that I want to buy. That's extortion. The subpoena on bank fraud, or the threat of the subpoena, or the threat of the investigation on bank fraud, has nothing to do with bank fraud. It has to do with him wanting to get a mortgage for his house. That's extortion. State legislators sit in a room and say, we'll threaten the governor with subpoenas and with investigations, and the statement is supposed to be, to leverage him in the budget, which is about getting money for them in their districts. That is possible extortion. And that's what was in the newspapers, not from me. And I said clearly that, look, what happened in retrospect was you had this controversy about the March 25th memo, which starts in March, April. I do believe it was highly politicized, but we had the Department of Justice request. We were fulfilling that. We paused the state legislative request, and then we were managing a pandemic day to day. So there was a void created in the amount of public information we put out. And meanwhile, you have all this chatter. The March 25th memo brought COVID into nursing homes. That's why people are dying. And there was a void in information. And that void created confusion for people. And my administration created that. Now, it takes a lot of time to keep providing information. It takes a lot of time to knock down every bad rumor. It takes a lot of time to knock down every bad tweet. And people were working every day to save lives. I get the explanations, but it's not an excuse. The void created misinformation, and the misinformation created pain for families that lost loved ones. And that's what I feel bad about. You know, Twitter, can you correct everything on Twitter? No. Can you stop the political back and forth? No. Are these partisan mouthpieces ever going to stop? No. But that void of information caused the families who lost a loved one tremendous pain. And I have had dozens of these conversations where they couldn't see their loved one in the nursing home. They couldn't talk to them in the nursing home. They were walled off from them. And all they heard were these rumors and these theories and these conspiracies, and they weren't getting any facts. And then people died in a nursing home. They died in a nursing home, never saying goodbye to a loved one. There was no closure. The loved one couldn't even come to say goodbye. They just get a phone call. Your father died, your mother died, your sister died. And in many cases, they hadn't seen them in weeks. And people died alone. This is a horrific, horrific situation. Horrific. And people want answers, and they weren't getting answers. And that's what I feel bad about. That's what I feel bad about, because it exacerbated the pain. Yes, they were conspiracy theories. Yes, it was politics. Yes, it's Twitter madness. Yes, people have their own agendas. Yes, there are political animosities with the Donald Trumps of the world and the Ron Kims of the world, and people have their own political agenda. But the net was the void, the misinformation, and the pain it caused. And that I feel incredibly bad about. Because it's not the family's business whether or not Trump likes me and I like Trump, or who Roger Stone is, or what the New York Post's politics are, or who Ron Kim is, or who any of these people are. They just felt bad. And I made it, the void made it worse, and my administration created the void. And that I feel bad about. Not illegal, not unethical, but just failed people in that moment. Next question, operator.
Our next question comes from the line of Nick Reisman from Spectrum News. Go ahead, please.
Hey, Governor, you got me?
Yes, sir, Nick.
How are you?
Good.
So, I wanted to ask you more about vaccinating people in nursing homes. You kind of alluded to this, but for the people who are going into the facilities after the vaccination program has officially or formally ended, what is the plan to ensure that those people are going to be able to have access to the vaccine? Will it be on a rolling basis? It's an issue that some medical directors have raised recently.
Okay. Let's just go back to the nursing home program for those, unlike you, Nick, and myself, who live this every day. The nursing home program is what they call the long-term care facility program. The federal government offered a program where they would directly contract with nursing homes, with pharmacies, and the pharmacies would do the vaccines in the nursing homes. New York opted into that program. By the way, if I had to do it all over again, I would have not opted into that program. It was slower than it should have been. But we opted into the federal program. They contract with pharmacies like CVS, Walgreens. CVS, Walgreens goes in and does the nursing homes. They have finished offering everyone the doses, staff and residents, as you suggest. Yes, but there may be new nursing home residents who come in who didn't have a vaccine. There may be new staff that the nursing home hires who didn't get a vaccine. And there may be people who just change their mind and say, I didn't take the vaccine, but now I'm ready to take the vaccine. We will keep doses available for all those people. And the nursing homes can get them through the local health department in that area. So they would contact their local health department. They would say, we have 10 new staff members who want the vaccine. And the local health department will have that supply. Gareth, is that correct? Did I leave anything out?
No, that's exactly correct. And we have, for the pharmacies that have finished with these programs, we are in the process of taking back those doses that they did not use, and then we'll feed them to the local health departments exactly for this purpose, to accomplish the further vaccination of nursing home residents and staff.
Nick, but you reminded me. One other thing I said on the call yesterday, and if I didn't make this clear earlier, the Biden administration has increased doses. By the way, since the Biden administration has started, dosages have increased over 55%. So we have many more dosages, and they've only been here several weeks, right, the Biden administration. This week, the local health departments get an additional 5% that we announced last week, on top of the additional 5% they received the week before that, on top of the 5% they received before that, right? And we're giving the local health departments half of the hospital allocation that we had been giving to hospitals to do the hospital staff, because the hospitals have had 8 weeks to do their staff, and we're now taking the majority of that allocation, giving it to local health departments to do people with morbidities. That's about another 10%. So this week, the local health departments are getting 5% plus about an additional 10% to add the comorbidities. So they're getting more doses. The state's getting more doses. And what I offered the county health departments was, I'm very concerned about the fairness of the distribution. Not that it would be purposeful, Nick, but you have so many points of distribution that are not coordinated. Federal department sends to some pharmacies. I send to pharmacies. The locality sends to pharmacies. The state has a site. The county has a site. The feds have a site. All these multiple distribution points are we being fair in how the vaccine is being administered geographically and racially? Is there a skew in the county where within the city of Buffalo, one side of town, 7% got it. The other side of town, only 4% got it. New York City, we're pumping 30,000 doses into Brooklyn and 30,000 doses into Queens per week. But the Bronx is only getting 10,000 doses. I want the locals to really study that distribution network. And what I said is, we, the state, will set up a joint mass vaccination site with the counties, especially to alleviate any inequity they find. So if Albany County says the distribution has been heavier in the city of Albany and not as heavy in the northern part of the county, we'll do a state-county mass site in the northern part of the county to make sure we remedy that inequity, right? We know we have an inequity on the percentage of vaccinations with the black community, and we're already making efforts to equalize that. And we announced the 4 new sites upstate to do that. That's Brooklyn and Queens downstate. And that's our pop-up centers all across the board. If a county wants to do more in that regard, but they have to look at the numbers, because you can now see. I know that Nick got a vaccine. I know where Nick lives. You can look at the data and just see what the distribution of the vaccination is. And yes, it's going to be imperfect. I'm telling you that, because you had all these distribution sites. But let's find out where the inequity is, or the disparity. I don't even call it an inequity. It's not an inequity. It's just a disparity. Could be geographic location, could be hesitancy, could be a lot of things. And let's now take that effort, make an effort to resolve that inequity. And I would do that with the county by setting up a state-county mass vaccination site. Okay. Operator, next question.
Our next question comes from the line of Jennifer Luke from wabc-tv. Go ahead, please.
Good afternoon, Governor. You just spoke at length about the conversations you've had with nursing home families who have been devastated by what has gone on. There are still hundreds of thousands of families in this state with loved ones in nursing homes who they have not been able to see. Given the fact that residents have now been vaccinated, employees have been offered that vaccination, when will you change the visitation policies? Families see you allowing entertainment, sporting venues to reopen with rapid testing. Why not offer that option to these families?
Okay. I'm going to ask Dr. Zucker to respond to this. Now, by the way, this is the inverse of everything we just said, right? This is, why aren't you more aggressive in allowing people into nursing homes who may bring in COVID? Just because you have the vaccine doesn't mean you can't spread COVID. Correct that fact for the public. You can be vaccinated and you may not feel the symptoms. You can spread the virus. People have that misconception, and it's an important misconception. Oh, I had my vaccine, I'm going to go kiss my grandmother. No. Just because you have a vaccine, and I want Dr. Zucker to speak on this, just because you're vaccinated doesn't mean you can't spread it. So, and with testing staff in nursing homes twice a week. that doesn't mean they can't bring it in the interval between the twice a week. Doesn't mean an air conditioning repairman can't bring it in. And we still have people dying in nursing homes. We still, with everything, have people dying in nursing homes. I understand the human need for visitation. I also understand, and we all understand, the trauma of deaths in nursing homes. And that's the balance we're trying to reach. And I'm not a doctor. We rely on public health information, and that's why I'd ask Dr. Zucker to respond.
Thank you, Governor. Thank you. So a couple things here. The first thing is that there is a different risk for those who are in nursing homes than the general public, and so we know that. What you asked a little bit about the staff in your question, and the issue is that we are prioritizing getting rapid testing out to the staff. We've given 1.1 million Binax tests out to the staff because, as the governor mentioned, it is still getting into the nursing homes. It is being brought in from staff. We are very aggressive on that issue, and as the governor also mentioned, that people are still dying in nursing homes as a result of that spread. Regarding the question or the comment the governor made of how it spreads, yes, you can have the virus in your nasal passage and be able to transmit it to another individual, even if you have been vaccinated. This is why we say that until we have herd immunity in the community, we still need to wear our masks. We still need to take the necessary precautions, and that is why we've been very aggressive about that. I recognize, as the governor has mentioned, it's been very hard on the relatives of those who are in nursing homes, and as soon as we feel is safe, we move forward to the appropriate ways to get visitors there. Thank you.
Now, let me give you a further complication, okay? Because it's never easy. You said nursing home residents are vaccinated. Every nursing home resident was offered a vaccination. Every staff person was offered a vaccination. They were not mandatory. Gareth, do you have off the top of your head what is the percentage of nursing home staff that has been vaccinated?
Yeah, it's about 49%.
Can you give the sheer numbers?
Yes, it's we have 64,983 staff who have been vaccinated. We have 63,178,000 residents who've been vaccinated.
Okay, so roughly half the nursing home residents received. They were all offered, but what percent received the vaccine, Gareth?
We're at 73% of nursing home residents who've been vaccinated, who are currently in nursing homes have been vaccinated. And again, this doesn't include people who were vaccinated and then left the facility, went home, or were transferred out of the facility. So right now, 73% of current nursing home residents have received vaccination, and 49% of current staff have received the vaccination.
Okay. So half the staff has gotten it. 73% of the nursing home residents have it. 25% have not been vaccinated. And this is what the Department of Health has to balance. As a lay person, as a person who has talked to families through this for months, as a person who has lived with it himself, I wish every family could be together tomorrow. I wish there was never a holiday where the family was apart. I wish the full family could all go celebrate and enjoy their relatives in a nursing home tomorrow. This has been horrific. It has been horrific, and everybody has felt it. It's been worse in nursing homes, but everybody has felt it. I wish families could be together tomorrow. I am a big believer in family togetherness and support and solidarity, especially in these hard times, and I wish it could be tomorrow. We need the public health experts to tell us how to do it when it is safe. or do it safely. But as soon as it can be done, it will be done, and it should be done. Operator, let's take one more question.
Thank you, Governor. And lastly, we have Dan Clark from PBS. Go ahead, please.
Hey, Governor, how are you? Can you hear me?
Yes, Dan, how are you?
I'm well, thank you. Just wondering, I know you mentioned the other day that the Biden administration, well, I guess then it was the Trump administration, had been in touch with your office as recently as January 8th on nursing homes. I'm just wondering, since the new president took office, has anybody in your staff or even you had contact from the Biden DOJ on nursing homes? And just as a second question, on Assemblyman Ron Kim, I think for a lot of reporters, your comments on him today kind of took us by surprise. We weren't expecting it. There's a lot of political tension in the country right now, a lot of division, and I'm just wondering if you think that this kind of rhetoric should still exist, these kind of personal attacks against people, or if we need to lower the temperature.
Well, look, Dan, the Department of Justice is, President Biden becomes president. It doesn't mean he takes control of an agency the next day. So they are still the same people who were there under President Trump, right? I don't even know how many people have been confirmed yet at the Department of Justice. And I'll ask Beth, who's on the phone, if there's any update on when we sent information. I don't know the dates. But, Dan, take a step back. Yes, I have worked very hard to operate in a nonpartisan way. Even during President Trump, as you know, I worked very hard to be cooperative because I think hyper-politics is destructive, and this nation is hyper-political and hyper-partisan and vitriolic, and that was the Washington uprising. And I did work very hard with President Trump, and I had some success, I think you'll admit. And then ultimately we didn't agree because we didn't agree. I never said anything about Assemblyman Ron Kim. He attacked me. He attacked me and said that I obstructed justice in a letter today. He said today that the immunity bill was because of my political contributors. Those are very harsh accusations, Dan. And in this business, as we were just talking about, the void and disinformation, you can't not correct disinformation. You can't. That's the issue of the void on the nursing homes. Yeah, they were all conspiracy theories. Yes, but Governor, you should have corrected them. And these are serious accusations. So yes, I'm going to correct them because they're personal attacks. I obstructed justice, says Assemblyman Kim and several other legislators. That's a lie. That's a lie, Dan, and you know it. Because I said repeatedly, we paused the state legislative request, not the federal request. So yes, it was a lie, but he repeated it. And you can't allow disinformation to perpetuate itself. The Assemblyman says today that we passed the immunity bill because of political contributions to me. That's pay to play, Dan. And that's a lie. It passed in the budget by Assembly people and senators. Is he saying that his Assembly colleagues passed immunity because of campaign contributions they received? Is he saying the Senate colleagues passed immunity because of campaign contributions they received? And then there is a context to this, Dan. There's been a long hostile relationship with Assemblyman Kim. You know, there's a context. New York Post says this. Yeah, I know. There's a context with the New York Post, right? That goes back decades. There is a context with Assemblyman Kim, which has been written about in the papers, but I didn't see anybody mention the context today on the nail salon bill, which was the subject of a major Times expose. And the upshot of it was he was influenced by campaign money and pay to play. Ironically, the same thing he accused me of today. And in that article, my office has a quote that you could read to suggest that there was an inference of pay to play. That's what he accused me of today. Isn't that a coincidence? That's why I pointed out. Because it is the lesson from last year, Dan. If you don't correct the disinformation, it perpetuates. Well, how can you ever correct all the disinformation on Twitter? I know, it's whack-a-mole. I get it. But the flip side, which is what we've been talking about for 3 days, if you don't correct the disinformation and you allow a void, then that's an issue also. You didn't correct the March 25th memo was a mistake, and you let the Post run it over and over and over, and you let all these conspiracy theories go over and over and over, and then people got the wrong impression. The March 25th is not how COVID got into nursing homes. You have to take people through the facts. It takes a lot of time. You have to do it over and over and over, but you have to correct the misinformation. I do believe Ron Kim acted unethically, if not illegally. I do believe he has a continuing racket where he raises money from the owners of the salons who opposed the salon bill. I believe that. This is a man who was at the signing of the salon bill. And then the owners got upset. And then he's raised thousands of dollars from the owners. And he gave them his political operative who got paid by them to oppose the bill. And they're still fighting the bill. It's ongoing. So yes, that's the context for this. He accuses me today of what I accused him of with the nail salon bill. And I think that is all relevant. Do I try to assuage partisanship whenever possible? Yes. But if you attack my integrity and my administration's integrity, am I going to fail to respond? No. I'm not going to do that. And then, by the way, most recently, on the meeting, read the transcript. He said positive things in the meeting. And then he comes out and he does a New York Post story. And then he tells me that the Post misquoted him, and he told them, and he blamed the reporter for refusing to correct the story. And then he tells me he would do a statement clarifying. And then he never does the statement clarifying. So, yeah. At one point, there are situations, Dan, where you have to respond. If somebody accuses you of doing a news story because you're on a business, because your friend worked at the business and you were trying to get them good publicity, you have to respond. Well, I don't want to add discord. Yeah, I know you don't want to add discord. You have to respond. And all of this that I'm saying today, it's all in the public record. I could ask you guys, why you didn't add this context when you did your Google search? And you saw the New York Times with Alfonso David saying, my former counsel, yeah, it looks peculiar that he works on a bill, signs the bill, salon owners go crazy. He does a 180 and then raises a boatload of money from the salon owners and still does, and still is trying to change the bill. Sometimes you have to correct the record. And frankly, I should have corrected the record more aggressively last year when they started this nonsense about the March 26th memo and all the disinformation. That's the void. I was a little busy actually fighting a pandemic to tamp down every false political statement and every crazy Twitter allegation, because we were actually doing the job. And now, well, you should have corrected it then. Yeah, I get the tension. Do you do the job or do you run a full-time public relations battle? But that's where we are. And it's not personal. It's not political animus, Dan. It's this person's credibility and motivation and his action. And just read the New York Times story and what my people said. And it is what he was accused of, is what he's accusing me of. And, by the way, all his colleagues, because it was done in the budget. And you want to look at contributions from the healthcare industry to the Assembly and the Senate and his colleagues? Go ahead. Okay, guys. Thank you very much. Have a good day. Bye.
Ladies and gentlemen, this concludes today's conference.